Hi friends, today we will discuss about the experimental pharmacology. So what is experimental pharmacology? Before that, we will just check what is pharmacology. So as we know, pharmacology is the scientific study of the effect of drugs and chemicals on living organisms, where a drug can be broadly classified as any chemical substance, natural or synthetic, which affects the biological system. Pharmacology has got two major branches. The one is the pharmacokinetics, in which it refers to the absorption, distribution, metabolism, and excretion of the drugs. The other one is pharmacodynamics, which refers to the molecular, biological, and physiological effect of drugs, including the drug mechanism of action. So, in generally, pharmacokinetic means what body does to the drugs, and the pharmacodynamics is what drug does to the body. Then the types of pharmacology, the major types are the experimental pharmacology and the clinical pharmacology. So experimental pharmacology is generally termed preclinical pharmacology, and it is a branch or type of pharmacology which deals with the testing of new drug. It can be a synthesized chemical, it can be an isolated or extracted phytoconstituent or the plant extract on animals with proper protocol. The clinical pharmacology is the type which deals with the pharmacology of drugs in humans. The humans may be the normal or the diseased one. So, as we all know the importance of the pharmacology, so whether the drug is synthesized or the constituent from the plant is isolated or the extraction from the plant is taken, or any formulation is made with any synthetic or the herb, so it has to undergo the pharmacological testing before it goes to the clinical research to ensure the safety and the efficacy. So experimental pharmacology is again divided into two parts again. So in vitro and in vivo. So in vitro means the animal is not used, but the experimental testing of drugs is done outside the biological system, especially using the kits for the assays. In vivo, the experiments are performed in the living animals. It is also called the intact animal study or the in situ animal study. And sometimes the another part also will be there as a subclassification, which is the isolated organ study, in which the specific organ from the animal is isolated and the effect of different drugs or chemicals is studied on the particular organ. So what is the need of the pharmacology? So it is not possible and permissible to administer or test the drug directly on humans. So once the drug is identified after the testing of compounds, it is discovered and it should be tested on the animals to ensure its safety and the efficacy. So which are the animals used in the experimental pharmacology? So these are the animals. So let us see one by one. So this is the rat, how it looks like. So many types of the animal models can be used. So the rats are probably the abundant used animals for the experimental pharmacology. So many of the pharmacological screening models can be tested on the rats. The mice, similar to the rat but very small in the size compared to that of the rats. These are also used in variety of the pharmacological screenings. So the rabbit, mainly useful for the skin permeation studies and the ophthalmic models, and generally the antipyretic activity. This one is the hamster, which is very sensitive animal. Generally it is used to screen the antipsychotic drugs. Monkeys, as we all know, the monkeys are generally used for testing of the vaccines. Only the high equipped laboratories can be allowed to test the drugs on the monkeys. Only probably the central government laboratories can afford to do the experimentation on the monkeys, not all the normal laboratories. So the different various screening models are available. So for this I will make another video lectures for every animal models also in the future. So these are the different animal models which are there. So which are the factors to be considered for the model and the animal. So how to choose the model? It depends upon the pathophysiology of the disease, on what you are testing the drug, and the inducing agent, the mechanism of action of inducing agent, and the availability of resources as well as the facilities. It all depends upon these factors, that which animal model you are going to use. Then animal. So which animal to select? First you have to select the model, and the model can be selected only with the help of the thorough literature review. The facility is what you have. So generally, if I take the example of hamsters, you need to have very specific facilities along with the air conditioned room with the particular temperature maintenance system. Only at that time you can use the hamsters and such sensitive animals. And the availability also. So the clinical conditions, the climatic conditions, sorry, and the model of different experimentation also should be considered, and then only you can select the proper animal for the study. So this was the session for today. So I will be conducting further sessions also. So just follow my channel SS Brother Pharmacy series